Hello everyone, and I would like to first of all welcome you to this career counseling event with heartiest congratulations. I want you all to take a deep breath and for a moment enjoy where you have reached so far. है ना? ऐसा लगेगा कि आगे बहुत जाना है. I know you have to do a lot more in life. You you want to achieve a lot, but let's rejoice, let's be happy about whatever you have achieved so far. So you've done well. I am proud of you. I am proud of each one of your journeys. I know many of you had challenges, many of you had difficulties, but still you have managed to reach so far. I'm very, very, very proud of you. And today I thought I will address two things. In my session I will first talk about general aspects of how to select a branch, and I will try to answer a lot of FAQs which will be common to all branches, and then I will shift over to radiology and I will talk about radiology as a specialty and radiology as a career. I will also try to give you ideas on how to select an institute. So that will be my goal, and this is what I will try to do it. So first of all, be proud of yourself, and I would want all of you in the chat box to clap for each other. So when you clap for each other, you create positive energy. All of you, we are all at entire team DAMS is proud of your achievement. Okay, so let's start now. Let's start with the first thing. Now, first question with a cup of coffee, because now we are relaxed and you are relaxed and you have done your paper, results are out. So let's have a quick coffee and relax and think about what is more important. Is it branch? Is it institute? Please let me know in the chat box. ज़्यादा important क्या है आपके लिए, branch के institute? Now this is one of the things which is very, very important to be considered when you're making your choices. Now let me ask you a question. Like, I keep seeing students getting confounded by this variable. Now, may I ask you a question? Will you pursue anatomy at AIMS? Okay, so now what happens is I am putting a preclinical branch in a superlative institute. So don't get confounded by it. Branch is more important than institute. Your relationship with the institute will be for 3 years. Your relationship with your branch will be for your lifetime. And what is more important? A lifetime worth of relationship is more important. So always keep in mind that whenever in a dilemma, pick branch over institute. Okay, and gradually I will add to it the convolutions of whether MD or DNB also. I'll try to answer them as well, which is my second question. Now, should I pursue MDMS in a branch, DNB or diploma? So my answers here are number one. Okay, in a lot of branches which are medical branches like radiology, okay, like radiology, medicine, in which you don't have to do a lot of patient procedures, MD, MS and DNB are considered equivalent on all counts. Now there have been various court decisions on this also, and various announcement by the national board also, which say MDMS should be considered equivalent to DNB for all purposes, but there are three drawbacks of DNB which I want you to understand. Number one drawback of DNB is that if you later on want to join as a teaching faculty in a medical college, if you want to join as a teaching faculty in a government medical college, MDMS candidates are preferred. Number two important part, DNB is usually conducted in private institutes, and in private institutes what happens is that cutting exposure is less. So it may not matter to somebody who is going to pursue radiology, but may matter to somebody who is going to pursue surgery. So if you are going to pursue a surgical discipline, you have to find out that am I going into an institute where there is a good cutting exposure or not. While in a branch like radiology or medicine, that particular factor may not have that kind of weightage. Also, the third and probably the most important difference, and I want all of you to keep in mind this important point, passing rates. Passing rates are far better in MDMS than DNB. And in some specialties, like recently they had released the passing rates in pediatrics, and they had released the passing rate of pediatrics to be around 26% or 30% in DNB pediatrics. So this is a important red flag to be considered. Like if the passing rate of that specialty or that institute that you're going to join is low, you should keep it in mind, because you don't want to have a another stress of passing 3 years later. So DNB has three differences: cutting, eligibility for teaching positions in a medical college, and third is your passing rates. Now you might ask me, why is the passing rate different between MDMS and DNB? The difference is in the exam pattern. In MDMS, the practical and theory happen together, while in DNB, first they take a theory exam, and then if you pass the theory exam, then only you are eligible for practical. So it creates a level of difficulty becomes higher. And plus the exam has no internal examiners in DNB, while in MDMS you always have an internal examiner to help you. So, but all said and done, the passing rates in DNB have improved over the last 3-4 years. They have improved. One of the reasons they have improved is because the candidates are nowadays going with merit. That means you people with high ranks are joining DNB nowadays. So automatically they are working harder, because they are already wanting to, they are going by choice to DNB. So they are working harder. As compared to past, when earlier before NEET PG era, DNB was allotted via interviews. Now it is allotted through NEET PG. So the good quality competition candidates are going into DNB. So passing rates have improved. Theory exam is also now becoming more and more objective. That means earlier they were giving one long question. Now they are giving, each question is divided into sub parts, and each sub part has marks. So passing rates in DNB have improved, and I think one of the best passing rates are there in radiology DNB. So I would say that again, when we are looking at DNB, we have to keep in mind that it has a issue with passing rates. It is not easy to pass DNB, and that should be in your mind, and it is freely available. It is, I think there was a press release by the national board last year in which they had declared the passing rates of each specialty. And so that kind of current ratios will help you. And it should be a good question that you should ask any department that you are wanting to join for DNB. You should be asking के आपके यहाँ passing rate पिछले 3 साल में क्या था. Any institute that you are wanting to join for DNB, you should be asking the passing rates. So that is one thing that I feel is an important criteria. Other than that, as far as employability in the private sector is concerned, as far as employability in the non-teaching cadre is concerned, MD, MS and DNB is considered equivalent most of the time. Now don't get confused between DNB and diploma. DNB is a 3-year course, diploma is a 2-year course. For example, in radiology you have diploma in DMRD, diploma in or DMRE they say, or DMRD. In gynae they have DGO, in pediatrics they have DCH, in anesthesia they have DA. So diplomas are 2-year courses. They do not have any thesis. So in diplomas you don't have thesis, and these are 2-year courses. Okay, everybody clear? So what happens is DNB is considered MD equivalent, while diploma is not considered MD equivalent because the duration of the course is 2 years, while DNB and MDMS are 3 years and they have a thesis to be done. The government of India in the last few years has converted many diploma seats into MD seats. So I feel that going forward the diplomas will have less and less of value, and I will not recommend diplomas. Okay, so I hope this helps you. I'll talk about, I see one bacha has asked about radio diagnosis and radiotherapy. I will explain beta. So let's go narrow down now. We have talked about some generic things. Now you have to find out which kind of branch are you looking at. Now I see a lot of students asking me, sir, should I do radiology or should I do surgery? So I have to tell them that we are looking at poles apart kind of branches. There are branches which are poles apart. On the other hand, we have to find out, and I want all of you to think and tell me, Are you a physician at heart? Are you a surgeon at heart? Do you want to cut and operate and cure, or you want to become a medicine person? So what I have seen is people who want to do a medical branch are usually happy with medicine, pediatrics, radiology, dermatology. Then they keep balancing how busy a life they want. If they want too easy life, they go for derma or radiology. They want a little busy life, they go for medicine and peds. On the other hand, people who like surgery are comfortable with things like orthopedics, surgery, uh, obs and gynae, and to some extent opthal and ENT as well. But ENT has more of medical or OPD component. Ophtha has more of surgical component. So it's like you have to find what kind of branches you're looking at, then narrow down and try to create a list for your own self, that what is my preference number one, what is my preference number two, what is my preference number three, and what is my bottom line. That means below this I will not do anything. So you should create such a list. It is a good idea to do this exercise right now also. Put it on a piece of paper. What is your preference number one, preference number two, preference number three, and what is unacceptable to you. Which branches are unacceptable to you as a person, that you don't see yourself doing them at all. So that will help you to create the branch matrix that you will have to fill in the your in your say online counseling. So I see some people asking about radio and derma in terms of setup and future. So I'll take Sakshi has asked this question, Garima has asked. So let us take that question immediately. When we talk about radiology and derma, similar kind of people want to go for these branches because of they are not emergency kind of branches. But if I look at them right now and I see their potential, radiology as a branch has a lot more variety and lot more job options. Derma as a branch has less job options but more clinical potential and a potential to start your own high value practice. So dermatology is a branch which is focused towards say private practice, and it has a huge potential in especially in urban and semi-urban areas. Radiology has great jobs and has good potential almost everywhere. It is like radiology is like multi-purpose kind of a branch which fits into every department. That means every department needs a radiological report. Orthopedics people need radiology, medicine people need radiology, or surgery people also need radiology. So radiology has a wider acceptance as a team in a hospital, and so you can work in any hospital. You have huge number of jobs for radiologists. On the other hand, in dermatology, jobs are less, but private practice and clinical practice is more. So usually what I've seen is people who want to remain clinicians, who want to treat patients and but want a lighter branch, they go for derma. But people who are happy with diagnosing, looking at variety of investigations, looking at variety of diseases, they go towards radiology. As far as if we compare the two, jobs are more in radiology, that is for sure, and private practice is easier with dermatology. Okay, so again, I see some people have asked a question about setup costs. So setup costs would always be based on the what kind of setup are you talking about. Like for example, you might think in your mind that okay, medicine is easy branch, you can just put two chairs and start it. But in real life it doesn't happen like this. If you want to build up a nursing home, or you want to have maybe 5 patient admitted, 10 patient admitted, it will all change the cost spectrum. Similarly, in radiology, it would depend on the number of machines you want to put in. An ultrasound machine, which is the basic startup that any radiologist would put up, will cost you around 15 to 20 lakhs, while a CT and MRI would cost more. But usually people put it in steps. That means you can establish your ultrasound center gradually with footfall and more time. You can then go on and put on a CT or a MRI machine. Okay, and also, so one bacha has asked, what about SR-ship in radiology and dermatology? Senior residency is positions are more available in radio as compared to dermatology. In derma, PG seats are also less, SR-ship seats are also less. Okay, so I hope this helps you. And also we should always consider the bond. I see one bacha has asked bond factor. So my suggestions here are that any bond which is like 1 year bond, like I think in Maharashtra you have 1 year bond. 1 year bond should not scare you in the longer scheme of life. 1 year bond really doesn't make a difference, and you should actually go for your branch of your choice or college of your choice, because 1 year bond in terms of long term life is too small a factor to be considered. Okay. Secondly, you should also look at the money involved if you have to break that bond because of any conditions later on. Any bond of maybe 5 or 10 lakh rupees, less than that, usually you will be able to pay up with your own practice later on also. So you look at those values carefully when you are making a decision. But if the bond is too long and the price is too high, you can maybe change the sequence a bit to suit that clause as well. And okay, and I think I've been able to take mostly the questions. And okay, some again there are like some questions that I'll be answering in between also, don't worry. So please find out which are your top 3 branches, so that when you discuss more and more, interact more and more, you should be able to find that part here. And I also thought I should be answering this question for all of you, is that a lot of people have asked me question that there are 6-year integrated courses available in cardiothoracic surgery, plastic surgery via DNB. And in AIMS and NIMHANS also they have a MCH neurosurgery, pediatric surgery course. So 6-year courses should only be taken if you are very clear on the branch. If you are just getting attracted by the name, it is better to do a MS surgery first, then do MCH separately, rather than joining it as a bundle, because if you don't like it after a period of time, you are trapped. So it is better to do a 3-year course, then later on decide. But if you are very sure on the branch, which is unlikely at MBBS level that you will be sure, then 6-year courses should be considered only when you are truly passionate about, say, neurosurgery or plastic surgery and you really want to do it, then it is okay. If in doubt, better to do surgery and then later on decide about MCH. Okay. Now, again, I will, we will all talk about different places and things in our presentations. It is the broadest idea that I will say is always prefer big cities, because like Delhi, Mumbai and Chennai, Bangalore, and after that you can Ahmedabad, look at the capital cities of each state. Because if you go into a big city, what happens is big cities have aggressive culture. So like you must have seen even in your MBBS days, students from big cities had an idea on what to study, how to study earlier than when you are in periphery. So when you are drawing your preference list of colleges, you should always look at big cities first, Delhi, Mumbai and all those stuff. Also then consider hometown and language also. Now hometown is a factor that many people do not consider. But my suggestion to you is, when you look at hometown, what I mean is that suppose you are going to settle in Gujarat and you are getting the topmost Gujarat college. So but if you go to Chennai, maybe they have some extra exposure to learn, but that might be maybe 10%, 15% extra there. But if you stay in your hometown, you build a network, you get to know more people during your residency, you interact with more people, and all that helps you later on in settling down also. So hometown is an important factor to be considered, not only for your family comfort, also for your later on settlement also. Because during post graduation, you meet a lot of people of different specialties, you make a lot of friends, and all that network helps you later on in your practice also. So hometown should be a factor which should be considered. Language is an issue more in clinical branches like psychiatry, medicine, not in radiology. Radiology, pathology, language is not too much of an issue. So if I, again put it in a nutshell, when you are opting for DNB, look at academics, passing rate, clinical and cutting exposure. And also keep answering this question to your own self. Are you being shortchanged? Are you going to regret this decision later on? It is very important that you should be, this is the exercise that you should be doing. What are your top 3 choices? What are the branches that you will never do? एंड इफ यू आर गेटिंग इनटू समथिंग जस्ट के वो खत्म करना है तो गड़बड़ हो जाएगा. इट इज इंपॉर्टेंट टू फाइंड आउट दैट शॉर्ट चेंज मतलब कि खत्म करना था तो जो मिला ले लिया, ऐसा शॉर्ट चेंज मतलब कि सस्ते में बिक जाना ऐसे. सो जस्ट कीप इट इन माइंड दैट you know we all make some compromises in life, but if you make too much of a compromise that compromises your own happiness, then it is not right. Okay, I'll explain to you. Suppose maybe you have three choices, one, two, three of subjects, and maybe instead of one you get two. That is okay. But suppose you have three choices, and out of that you are taking your choice number 10, which you never wanted to do. If you go like for example, suppose you wanted to do surgery, but you could not get surgery, but you got orthopedics or like that. But you're okay with it, okay, that okay, I'm making some compromise but I'm okay, or vice versa. But if you take go for anatomy at that time, or or maybe pathology, and or maybe something that you wanted to become a surgeon, and you go into a paraclinical, you might have regrets later on. It's like all branches have their own role. It is about what you want to do. It is not about any branch. All branches are good, but important thing is what do you want to do. So I have seen if you match yourself to your personality time, you are able to do better. Okay, so that is important thing to consider. And the most important thing is draw your bottom line. By bottom line, I mean you should have a line that iske niche I will not be doing it. So that bottom line will always help you. Like for example, like I know some people would say, okay, I will do only clinicals, I will not go below this. Or some people will say, I will do only maybe surgical sides, not below it. Or I will do only medicine, radio and all, not below it. So everybody would have their own bottom lines. If you draw a bottom line, it tells you that okay, below it will be a compromise. I would rather give an exam, and in 2023 there will be NEETPG again, most likely. And most likely because they have tried to declare the result early, I feel they will go into the counseling process also early. I feel they are wanting to do the NEETPG also early, between January and March in the next year. Most likely in the first quarter they should be doing the NEETPG, looking at the current timelines. So it may be a good idea to appear again at the exam also. So my suggestion to you is draw your bottom line. Find your bottom line कि इसके नीचे नहीं जाना, इसके नीचे नहीं जाना. Okay. And also please understand that ये आप जब बाजार में जा रहे हैं, आपको ऐसा लगेगा कि ये अच्छा है, ये खराब है, ऐसा कुछ भी नहीं है. It is, every specialty has a role, and in every specialty you have successful people and you have people who are not doing so well. It is about your interest and your aptitude. Okay, so if you are a person who wants to do things, who wants to operate, you are a surgeon at heart, go for those fields. If you find that no, for me diagnosis is more important, then you can go for branches like radiology. You are a physician at heart, so it is about your interest. Don't look at the financial outcomes as your primary decision making at this stage, because what will happen is later on what will matter is your happiness. If you're happy, money would not matter. And actually money and everything that you look at as parameters of success are actually byproducts of success. So if you enjoy what you're doing, you will actually be making more money also, more respect also, more name also. So don't underestimate the potential of any branch. I have seen people take up offbeat branches and do very well if they had interest into it. So interest is a good factor. But some of you might ask me, sir, interest pata kaise chalega? So if you don't know your interest by now, it is a good idea to visit any hospital in your vicinity or your own medical college and spend 2 days in that specialty. Suppose you're not sure about radiology or dermatology or orthopedics or radiology, go and spend 2 days in orthopedics department and try to shadow somebody. Try to spend time there, not just talking. सिर्फ बात नहीं करेंगे, काम भी करके देखेंगे, so that you find that you truly belong there or not. Also ignore people who are going and telling you extreme opinion. No branch is too good, no branch is too bad. कभी कभी आप you go to a college and you meet somebody who says कि बिल्कुल मत ये तो बहुत ज्यादा हैवी है या बहुत ही बढ़िया है. तो ऐसा होगा नहीं, असली जिंदगी में थोड़ा ग्रे जोन होगा. तो don't get discouraged or super encouraged by extreme opinions. Try to find a median of opinions by talking to people at different stages in life. Like, first year PG in any department will be sad, will be angry, but SR or maybe a third year PG will be able to give you a better picture. So talking to more people down the line will help you more. Okay. And before I start talking purely on radiology, your gender does not matter, your background does not matter. Why I'm saying this is because a lot of people have written to me, sir, can a girl take surgery, can a girl take orthopedics, can a boy take obs and gynae? So my answer is yes, you can do anything that you truly want to do. Whatever background you're coming from, whatever prejudices or stereotypes are bogging you down, none of them will matter in the long run. Only thing that will matter in long run will be your happiness. Only thing that will matter in the long run is your happiness. If you're happy doing something, whatever other people might be saying it, if you're happy, you will be doing extra work, you will be happy, you will be successful, you will be putting extra effort for your patients, and if you're happy, your family will be happy. Many people, they get confused by saying that I am choosing a lighter branch for my family. Ultimately, but a family doesn't want you all the time. Family wants you to be happy. If you're a happy person, you will be able to give quality time. As a doctor, what I believe, your goal in the long run has to look at the word quality time. So more quality time that you spend with your family and your loved ones will help you to build lasting relationships. As a doctor, quantity is not easy to get. So अगर मैं बोलूँगा कि खाली होगा हमेशा, तो मुश्किल होगा, ऐसा होगा नहीं किसी भी ब्रांच के अंदर. So what matters is that you should be enjoying what you're doing. So I have seen surgeons who are very busy, but because they are enjoying their work, I have seen many of them to be very happy. Okay, so that should be the mindset that should be helping you, make up your mind, make up your decision. It is your happiness that matters. So before I start talking purely on radiology, my questions are: find what kind of person you are. Are you a medical person or a surgical person? Look at, when you're looking at branches, look at capital cities first: Delhi, Mumbai, Chennai, Bangalore. Look at hometown advantage also. It matters in the long run, because it's like what you will become later on will be a sum total of your clinical exposure, your network that you build up, and how much you study. And a lot of people have also asked me, sir, कोई ऐसा पीजी का ब्रांच बता दो जिसमें पढ़ना ना पड़े. वो ऐसा मेडिसिन में या MBBS के अंदर ऐसा कोई भी ऑप्शन नहीं है. So there is no option where you will not have to study. पढ़ना तो पड़ेगा, सीखना तो पड़ेगा. At DAMS now we have started resident courses for medicine, surgery, obs, gynae, pediatrics, psychiatry, ophthalmology, which are doing very, very well. And we are looking to start more and more resident courses also. Some resident courses are radiology, maybe we have started some of them, they are already there. So we keep adding more courses for residents also. But my goal here is to make sure that I'm an educator at heart. मुझे पढ़ाना पसंद है. I'm a teacher. So मुझे लगता है कि मुझे पढ़ाना है, तो I keep finding ways to teach, and I keep finding ways to touch lives. You have to also find your own happiness, है ना? So that happiness would matter. So make your bottom lines कि इसके नीचे मैं नहीं जाऊंगा. So that will help you to fill up your choices in the counseling. That will help you to decide about your should I give one more attempt or not. And one final word, then I'll switch over to radiology. That is, if you are in a gray zone, if you are at a rank where you feel that I may or may not get what I want, keep studying also. There is no harm in keeping studying. You might target the November INI exam, you might want to target the NEETPG exam, but keep studying also till the time you are satisfied with what you are getting. I have seen last year many people, they came to me a little late after the counseling process was, they could not get their branch which they were hopeful. So it is important to keep studying also side by side, so that you are always in the safety net that I am preparing for come what may happen. I wish you all the best.